Hello, I'm Dr. Jeff Rose with Carolina TotalCare. Today's topic is chronic pain or chronic inflammation, as they usually often go hand in hand. Many patients today come in with complaints of pain that have been in existence for more than 3 months, which is what's considered to be chronic pain. But many of these cases are for years. It could be 10. Just recently had a patient with chronic pain for 15 years. So what causes pain to last and to linger so long? Why is it not something that has been able to respond to medications or other treatments? Well, usually in the case of chronic pain, there has become some prolonged irritation to the nerves. With this, I kind of like to tell my Michael Jordan story. Since we're here in North Carolina, everybody knows that Michael Jordan became one of the greatest basketball players of all time. But what they don't often know is that in his early days, Michael Jordan actually wasn't that good at basketball. He actually didn't make the high school team in the beginning. What he did was he went and he worked harder and harder. He got good coaches and he had training and he learned how to play basketball to the skill set that he got to. But ultimately, in the beginning, one guy could have stopped Michael Jordan on the basketball court. At the peak of his career, 5 guys could barely handle him. And that's really how pain works in our body. See, pain is supposed to be simply a sign that says, hey dummy, get your hand off the burner. And as soon as you remove it, the pain signal is gone. But nerves have a memory, and they communicate to the brain in the way that it can form a memory as well. And so if it's practiced enough, if that irritation is there enough, and if that pain signal lasts over and over and over long enough, whereas simply removing the irritation is often enough in the beginning to alleviate the pain, now the body has become like Michael Jordan. It's become so good at communicating that pain signal that there's no ability to stop it. The medications don't work, the injections don't work, and many times even surgeries don't work. So ideally, it's important to catch that pain before it does become chronic. And that's where chiropractic can be an excellent treatment option to assess and determine if what's causing the pain is coming from a musculoskeletal or a structural problem. Because ultimately for chiropractic to help, that's what needs to be the root of things. But sometimes that's not an option or people don't know. And so we do many times get patients that have had pain for years. What chiropractic's looking to do in those cases is determine, again, what is causing that chronic pain. At that point, many times there is degenerative arthritis. There's some disc disease. There's been a prolonged dysfunction there to the point that the nerves in that area are just used to telling the brain, I'm irritated, I want you to feel pain, so you know there's a problem. So chiropractic in those cases, it's much more challenging as any treatment is. But if there is a determined cause there that is a structural or a musculoskeletal problem, then chiropractic serves to try to alleviate that irritation, to restore normal function. And the beautiful thing is that the body was created to heal. So just like if we cut a scrape or a gouge on the surface of our skin, as long as we cleaned out the debris, the body will heal. It'll take over. It doesn't need any extra help. Well, the same's true on the inside. And what people don't realize is that if you can remove that obstruction, that irritation, the body does the rest. And that's really the secret. That's the beauty of chiropractic, is that chiropractic just gets that obstruction, that irritation out of the way as best as possible, and the body does the rest. So if you have chronic pain and you've tried many different things, but maybe you haven't tried chiropractic, maybe you have. It's not something that you should just give up on. As we know, chronic pain and the medications associated with that are becoming a huge epidemic problem in America. So find out if there is still hope, still options for you. Contact us here at Carolina TotalCare and let us help you to determine if treatment is an option for you.